Hello everyone, I am Dr. Ashwin Tamhankar. I am a consultant in Urological Cancer Division and Robotic Surgery Division as a part of Surgical Oncology Division of Apollo Hospitals, Navi, Mumbai. Today we are going to discuss about role of robotic surgery in prostate cancer. I want to give some background before we actually jump into the main discussion. So prostate cancer is a second most common cancer in a man, hence very much important. We learnt about the role of screening in prostate cancer, which should be a simple test of PSA and examination starting from the age of between 50 to 75 years for every man. We basically prostate cancer diagnosis and incidence is increasing in last few decades, and the main aim is to detect the cancer in an early stage so that we can offer a curative modality of intent by offering a surgical intervention for these patients. So in surgery, essentially surgery is called as radical prostatectomy. We are going to discuss about the steps of the surgery in the form of a video, but most importantly, I should say that we will have to understand that prostate cancer, this is the most important surgery for which the robotic surgery had been invented in year 2000, and in last more than 2 decades it has paved the way and the results are phenomenal. So essentially what we do in the robotic surgery for prostate cancer is patient is anesthetized, patient is given an adequate padding and a position. Small ports or small 8 millimeter cuts are taken in the form of multiple ports in the body of a patient. On the ports, the robot is docked. Surgeon performs the entire procedure by sitting on the console, and the all movements are translated into the body of the patients in a very precise manner, thereby having better recovery. So essentially what we do in this procedure is we separate the prostate all around from the bladder and separate the prostate all around from the urethra. So prostate lies between the bladder and the urethra. We take the prostate out of the body of the patient along with the lymph nodes and then join the bladder to the urethra in the form of a new joint. Robotic surgery gives us advantage in the form of sparing the nerves of the patient, that is called as nerve sparing prostatectomy. And after the prostate is taken out, we reconstruct the urethra or the urinary channel by joining the bladder to the urethra or the water pipe. We leave a catheter in place for some time for the healing to happen, and generally after that the patient is the ports are closed and patient is shifted to the recovery. So I'll tell you the standard course of a patient undergoing this particular surgery. So patient generally is walking on the very same day. Patient is fairly pain free. We just need paracetamol as a part of a painkiller. They are all pain free on the very first day. They are started on the liquids and diet on the very same day. They are walking. The next day they are shifted to soft diet. They are walking on their own in the ward. As a part of standard recovery, they generally get discharged within 48 hours after the surgery with the catheter. The drain pipe generally comes out before the discharge. So what translates into these kind of advantages? Most importantly, the precision of the surgery. The robotic platform gives us a 3-dimensional vision. It allows us for bidexterity of the movement. It gives us opportunity for motion scaling, and most importantly a magnified 20 times magnification of the vision, and hence there is hardly any blood loss. We generally do not need to transfuse these patients with blood, and there are only small cuts in the body of the patient, and the entire thing is done in a complete minimal invasive manner. So honestly speaking, gone are the days of open surgery for prostate cancer. Like I said, this particular robotic platform was maximally utilized and invented for the prostate surgery. There is a reason for it, because prostate lies deep in the pelvis. So a robotic surgery and the platform gives us maximum opportunity to have the best possible reconstruction and translating into the cancer outcomes as well as functional outcomes. The joint which we create between the bladder and the urethra is easily doable, and in a maximal safe manner it can be done by utilization of the robotic platform, and hence it translates into the cancer outcomes as well as functional outcomes of urinary control and sexual function recovery, especially when we spare the nerve, that is called as nerve sparing radical prostatectomy. So just to summarize robotic platform, nearly 99% of these surgeries are across the globe for prostate cancer are being done robotically, and only and we are not lacking behind in India. We do offer these surgeries to the deserving candidates or the patients, and the cost is also not a hurdle these days. Thank you so much.